So culturally in Trinidad and Tobago especially, after pregnancy loss, people can be very judgmental, or as we say in Trinidad, out of timing, right? I would really say, if you are reacting or around someone that has experienced pregnancy loss, I encourage you to stay quiet.
I was already a mother of one, and my husband and I were trying to have a baby for over a year with no success.
The day we found out I was pregnant, I was absolutely overjoyed.
4 months into the pregnancy, one day I started to bleed.
The doctor confirmed that my baby just passed away,
but my body had only just recognized a miscarriage.
I still had pregnancy symptoms and was even growing bigger. I didn't even know this was a possibility.
The doctor confirmed that my baby passed away, but my body had just recognized the miscarriage.
I still had pregnancy symptoms and was even growing bigger, but had no idea my baby was actually long gone.
I had a surgery done, my baby was removed, and parts of me felt like it was also gone.
I know, people would say it's normal, it's very common, it's more common than we think, but I don't think it's something that we really understand unless we're in this situation. And I don't think it's something that is spoken about enough to bring awareness.
This is always something that's really difficult because you feel deceived by your own body. And so we say, we like to not use months in pregnancy. In the medical field, we use weeks. So for 12 weeks, that mother thought she was pregnant. And usually at that marker is when you tell everyone. That's when you start to show as well a little bit more depending on the person. And I'm just thinking that at that visit, the intent, generally the mother would have had good news. And yeah, it's hard. It's really hard. Hello, I'm Dr. Meagan Mohammed, and I'm a medical doctor, currently specializing in the field of obstetrics and gynecology. Firstly, I just want to say thank you to everyone who shared their story. It was so deeply personal. This topic in particular is very hard to deal with. And so I just want to thank you for being vulnerable and sharing that. And it just goes to show how important sharing your story can be. In the Caribbean, research shows that anywhere from 10 to 25% of pregnancies end in loss. And when it comes to stillbirth, there are numbers from 8 to 20 per 1,000 births. And overall, especially for miscarriages, these numbers are highly underreported whether or not people seek medical care. Now, these numbers are a bit staggering. Globally, actually, it's reported about 23 million miscarriages happen annually, which is about 44 pregnancy losses per minute. Just think about that. That means pregnancy loss is more common than you think. Medically, there are definitely some things that you can do to take care of yourself after having a pregnancy loss. But of course, alongside the medical, there are definitely some holistic ways that you can ensure that you recover after having a loss like this. So firstly, rest and monitor your body. Now, generally, you will get instructions from your medical provider, but you also need to make sure that you are aware of the changes that's happening at this time. You definitely should look out for signs of potential infection like fever, pain, and prolonged times of bleeding. Secondly, it's really important to attend your follow-up appointments. Sometimes this can be a call from your medical provider or an actual visit in a clinic setting. Now, this is really important to ensure that everything is okay with you physically, but also gives you a space to voice your concerns or ask questions. Thirdly, it's really important to talk about it. Whether it be your healthcare professional, a mental health professional, or a support community like this one, talking is really important to process this emotional trauma. Lastly, you need to know that it's not your fault. Most losses are beyond anyone's control. You're not alone and help is available. I just want to add that you need to be able to grieve in this time. After an experience like this, it's very much okay for you to not go back to life as normal or as usual. Grieving after an experience like this is really important. And if you don't deal with it now, it can definitely affect you in the future. I just want to also encourage you that in this time, faith is really important. And a faith community group is also really helpful in a time where you are just down and feeling like you're defeated. There's always help out there. So culturally, in Trinidad and Tobago especially, after pregnancy loss, people can be very judgmental, or as we say in Trinidad, out of timing, right? I would really say, if you are reacting or around someone that has experienced pregnancy loss, I encourage you to stay quiet. Let them share as much as they want to share. Be loving, be there, just be present with them and ask what they need. It seems like that's what we should do, right? It seems like that would be your first thing to do, but in general, people are not as considerate. And that's general. But I'm urging you, I implore you, people who are watching this, when someone brings this topic up, just try to listen as much as you can and be there and see what they need at that time. Because you, even if you experienced it before, you could have possibly dealt with it and moved on and healed. But that person is going through it right now, or it could be, very recent. So I would definitely say that we need to learn to be more considerate and compassionate when people bring up these things, because in general, it's not something that people talk about a lot anyway. It's painful. So when someone actually brings up their pain and their trauma, let's try to be nicer. From me, Dr. Mohammed, to you, if you are going through something like this, I just want to reiterate how important it is that you have support. You are not alone. There are resources available, and it's really important to find community in this time. Besides all of the medical things that you may have to go through, I do want to encourage you also to advocate for yourself. Let people know when you need help. Let them know if you're in pain, if you realize that something's not right. Ultimately, yes, sometimes we don't know what's going on with our body, but if you feel like something's wrong, seek the help that you need. Medically, of course, but if you need it, seek a mental health professional. Community groups like this, it will really help you to heal and to process. And there's more and more research that's coming out now about how emotional trauma affects us as people. But if you don't deal with your emotional trauma now, it very much can manifest in the future with physical pain, as well as many other things that can go on with your mental health. So I implore you to ensure that you get the help that you need when you're going through something like pregnancy loss.